I'm Dr. Anwaar Kiani. I'm a consultant trauma and orthopedic surgeon. I've recently returned from England, and I've spent about 17 years and trained over there. And I've finished my FRCS orthopedics and just returned back and I've started practicing Rawalpindi in Islamabad. I was always a sports person in my school years and college years, and I loved playing cricket. I just went with my studies, and then going to England was especially special for me because I wanted to play cricket in England grounds, and also I have to do my surgical training, which I did. Staying physically fit is always important, because it's all about your physical health, right? It's mainly it kicks in. It's when you don't do anything, when you don't do any exercises, you have a sedentary lifestyle. You sit at home, sit at sofa, watch telly, and do nothing. And the cartilage in all the joints, like for example a knee joint, it needs loading and unloading to get nutrition. So if you don't do any exercises, so you're going to get thinning of cartilage, and you're going to get some arthritic changes, and it depends how quickly you get. So there are two types of arthritis. One is which is age related, and it can also run in the families, and the other type of arthritis is what we call it inflammatory arthritis, especially the inflammatory one. If it runs in the family, then it affects mainly small joints, like small joints of the hands and feet. So early morning stiffness in the hands, that's the key thing. You shouldn't just ignore it. You should go to the specialist. You need to see that, because this inflammatory type of arthritis has many causes, like rheumatoid arthritis, there ankylosing spondylitis. It can also affect your spine. So what you need to do is you need to see a consultant, a rheumatologist, or even in Pakistan, I think I've seen quite a few patients with these kind of conditions, rheumatoid arthritis, and there is a special medicines for that, which actually prevents and slows down dramatically the progression of arthritis. The key is to prevent progression of arthritis to a stage where we can't treat it with the medicines, and eventually you have to have a surgery. I mean, genetic variability, I mean, you can't tell that if someone's dad has it, he'll always have it. So, I mean, having a healthy lifestyle, having good diet,
will reduce the chances.
And exercises, right? But if someone is getting it, it is unfortunate, but the problem is, if you talk about 20 years back, there are not such medicines, which we call disease-modifying anti-rheumatic drugs, and they're very good and stopping and progression of arthritis. So we're talking about inflammatory arthritis. So if we talk about osteoarthritis, which is like age related, when everyone grows old, he or she will get some sort of changes in their joints, and that you can prevent that by doing exercises, by developing your muscles, especially if you talk about knee joint. If you have a good quadriceps, hamstrings, and if you're doing exercises, your knees will do well. So, and if especially arthritis, what I call it is it occurs because excessive loading of normal joints, it can cause arthritis. Like in obesity, that's a problem. Weight reduction is the key, because all the body weight goes through your joints, and that's the key to prevent those knee pains or arthritis in your joints. And similarly, if somebody had an accident or fractures involving the joints, involving the femur or tibia, what happens is, if they're not properly fixed, then the weight-bearing axis goes differently, and that can affect your knee, that can affect your ankles as well. So you're going to get arthritis or pains, and symptoms-wise, you'll get pain, and it only gets better when you take medicine. So that's the key. I mean, if you have a problem and if you sit on it, it's going to get worse. So you have to go to a specialist to seek advice, because there's assessments. There's a clinical assessment, and there are radiological assessments where we do some alignment X-rays, alignment CT scans can be done, and these are the things which we do, and to prevent, as I said, my aim is to prevent progression of arthritis to a stage where eventually the patient is going to have a joint replacement surgery. So though I have specialized in joint replacement surgery, but my patients, I just teach them and educate them that, look, that's the way. I mean, initially you can get rid of pain with painkillers. Later on, in the moderate stage, where we can give you some injections like steroid local anesthetic injections. And recently in America and Europe, people are trying different things like PRP injections and some growth factors, but technology is not here yet where we can give those to the people. There's a selective group which will benefit, which is I would say mild to moderate arthritis, where you can inject these things in the joints and help cartilage to not deteriorate more. But at the end, when you develop the deformities and the bone is rubbing on the bone like end-stage arthritis, you can't do anything. I mean, I've heard few people have been trying some odd things, I would say laser therapy and things like that. It doesn't work, to be honest. PRP works, as I said, mild to moderate arthritis, but not in a severe arthritis. At the end-stage arthritis, I don't see any value of PRs. What the problem is, you have to choose your surgeon or your doctor carefully, because knee replacement or any joint replacement, I do hip and shoulder replacement as well, but the key is to balance the ligaments, to balance the soft tissues around the joint. And there are certain things, it's not just about cutting a diseased part of the bone and replacing it with the metal, and it's not like that. And it's quite unfortunate in Pakistan, we haven't developed especially joint replacement surgery or sports injury management to such an extent where we can train the people. A few of my friends have been training and they've started doing training, and I have an aim to train people as well. But at this stage, when she had knee replacement which didn't work well for her, there are certain risk factors or complications. We do warn the patient about that, but for example, knee replacement surgery success rate is 95%.
Okay.
So if you had 2 or 3 surgeries, which I mean I don't know exact detail, but she might have some infection, she might have some other issues, she might have some problem with the ligament balancing.
Okay.
So what happens every time you do a surgery, you lose some part of the bone. You lose the bone stock, what we call the bone stock.
Okay.
Because we need some bone to support our implants if you're doing a third surgery. And a revision surgery, which I do as well, which has got altogether different implants.
Okay.
So where obviously we have to compromise in mobility of the joint, and we give a kind of a constrained kind of a prosthesis where the joint is stable, but it doesn't move as much as we do the primary total knee. As physiotherapists are the part of the team, and they have a huge impact on orthopedics. To be honest, over here they have been neglected. I have got a couple of physiotherapists in my team here in Islamabad, where I've been talking to them. We need to develop that, because when we do a joint replacement surgery, or let's say a sports injury, if you do an ACL reconstruction, what I need to do, I need a good physiotherapist to build the strength in the muscles, to just supervise them with their exercises, and basically every joint has got some key muscle groups around it, and that needs to be developed, and physiotherapists, they just teach them, train them, and guide